my video for Module 12. This module is for the ranges of motion, neurological testing, and the bony landmarks and soft tissue. This is my model. This is my little sister. So we're going to start out with active range of motion. I don't have a goniometer, so I'm going to describe where it goes. Turn sideways like this so she can see. Okay. For flexion and extension, the fulcrum goes on the lateral epicondylitis. The stationary arm goes up the shaft of the humerus, and the movable arm goes down the shaft of the radius. So for flexion, I'm going to have her flex her elbow up, and I would move the movable arm up to match the shaft of the radius. Flexion is usually 145 to 155 degrees. For extension, the placement is the same. We're going to start in the flex position. Again, the fulcrum is at the lateral epicondyle, the stationary arm is up the shaft of her humerus, and the movable arm is the shaft of her radius. Might have her extend her elbow and realign the movable arm with the shaft of the radius. Normal is 0 to negative 10 degrees. If the elbow goes past 0 degrees, it could possibly mean that there is some ligament damage, but also if this is a baseball pitcher, they also normally have a hyperextension of their elbow. Okay, so now we're going to go to supination and pronation. Turn back this way. Grab your pencil to help just identify. So for pronation and supination, the fulcrum is over the third metacarpal. The stationary arm is going in the direction that her hand is not going, so we're going to do pronation. So the stationary arm is going to be going this way. It's aligned with the midline of the humerus. The stationary arm is aligned with her metacarpals, or in this case, the pencil. So she's going to pronate, and you realign the movable arm with the pencil and with the metacarpals. Pronation is normally 90 degrees. We're going to do the same thing, except for this time, while the fulcrum is still at the metacarpal, the stationary arm is going to be going the opposite direction, still aligned with the midline of the humerus. Supinate, realign the movable arm back up with the pencil. Again, normally 90 degrees. Now we're going to do passive range of motion. So she's going to let me have her arm. So I'm going to passively flex her arm, let go, passively flex her arm, extend it. We're just feeling for soft ends, point end feels of the joint, and then going to passively pronate and supinate her arm. And that's passive range of motion. So for resisted range of motion, she's going to flex against my hand, go up, 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 there you go. And you want to test all of these bilaterally, but I'm just going to do it on this arm for right now. We're going to do resisted extension, yeah, okay. Resisted pronation. This is supination. Okay, that was resisted range of motion. Now we're going to go to neurological testing. So we're going to do dermatomes and myotomes for C5 through C6. Through C5 through T1. So for C5, I'm going to have her put her arms on her legs like that, and I'm going to take this pencil just because it's a little bit sharper than my finger would be. We're going to do the dermatome. So does this feel the same as this?
Yes.
Does this, that's C5, this is C6, does this feel the same as this?
Yes.
C7, does this feel the same as this?
Yes.
C8, does this feel the same as this?
Yes.
And T1, does this feel the same as this?
Yes.
Okay, great. Now we're going to do myotomes. So myotome for C5 is resisted shoulder abduction. So you're going to abduct your shoulder against my hand. Good. You're just looking for weakness when compared bilaterally. Do this side. Okay. C6 is resisted elbow flexion. So flex your, don't let me push you down. Okay. Again. Don't let me push you down. C7 is resisted elbow extension. So don't let me extend a little bit more. Don't let me pull you up. Don't let me pull you up. That's C7. C8, can you take your thumb and your pinky and press the pads together? Good. And T1, spread your fingers. Don't let me push them together. Okay. And then for distal vasculature, to make sure if there's an injury that there is no compromise of the distal vasculature, you can check your the patient's radial pulse. You can also do capillary refill of the fingers. So that was neurological. For my sport, I chose softball because this is a softball player. And for my functional activity, I chose taking some marbles, spreading them out, and having her place them back into the jar. And then for my activity specific, I chose throwing and catching because that's a big part of the sport. All right, so now we're gonna do bony landmarks. So I'm gonna take her arm. Okay. So we're gonna look, first we're gonna go to the ulnar. We're gonna start up here. We're gonna go to the olecranon process. We're gonna start there. Go to the medial epicondyle, lateral epicondyle, the ulnar head, and the radial head. And then for soft tissue, we're going to start with the triceps insertion at the back of the elbow. Go to the biceps insertion on the anterior portion of the elbow, the cubital fossa, the UCL on the medial side of her elbow, the RCL on the lateral side of her elbow, the capitulum, which goes down from the humerus and goes down to the radius, so it goes down in this area, and the annulus, which goes from the radius and wraps around back to the ulna. And that's it for the Module 12 video.